Data shows between the loss of jobs, life, and an increase in isolation because of the pandemic, more people are struggling with their mental health than ever.
Nearly 8 in 10 individuals polled said that the pandemic is causing an undue amount of stress in their day-to-day life, and that stress is increasing.
Idaho has one of the highest suicide rates in the entire nation, and many of those happen in the state's rural areas. Mental health researchers say there are multiple factors behind the high suicide rates in rural areas. Just a few: the stigma surrounding mental illness, ready access to firearms, a lack of mental health resources, and what they call a rugged mentality, the mindset you don't need to seek help.
We see these as risk factors in rural areas. And so we think, okay, well, what can we do about that?
Dr. Clarissa Richardson, a researcher with the University of Idaho, has been studying mental health in Idaho's rural communities for years, working towards solutions to bring rural suicide rates down.
The research says you need to do community-based work. You need to get the community involved in the process.
That community-based work means much of her research has been centered around educating those communities about mental health.
I think there's something special about rural communities in that they tend to be there for each other. But what individuals within rural communities also struggle is that they don't know how to help. Even if they did want to help somebody who was struggling, is they don't know how.
Experts say a big part of the solution is working to end the stigma surrounding getting help.
Behavioral health, mental health problems touch everybody. At any given point in the population, 1 in 5 are suffering from symptoms that affect them. That doesn't mean they're dysfunctional. It doesn't mean they can't work. It just means that something is going on that they could get help for.
Experts add telemental health options have been a game changer for those in rural parts of the state.
What we're noticing at Regions is a significant increase of folks reaching out and asking for behavioral health. Luckily, we've shifted so that a lot of our services are now provided through telehealth.
In Twin Falls, Natasha Williams, Idaho News 6.